Hello once again and welcome back to Clinical Next with Dr. Abosede Adibite. I'm a consultant family physician and today we'll be talking about what to do when a person slumps. If it happens in your presence, what will you do? Lately it has happened, a person might be singing and then they slump. A person might be preaching, they slump. Another might be on the football field or basketball pitch and then it happens. So in the confusion, some people are running helter-skelter, achieving nothing, yelling, pouring water on them. No, there is no need for any confusion if such a thing happens. Your composure might help the person. So you need to be calm, you need to be composed, and you need to know what to do. So what should you do? The very first thing to do is find out if they are conscious or not. They have collapsed. Move close to them. Tap them. Call their name. If they respond, then obviously they are conscious. If they do not respond, are they breathing? If they are breathing, you will see their chest rise and fall with each breath. Or you can feel for air from their nostrils. Or you should also check whether they have a pulse. If they have a pulse, you should feel a burst here at the base of the thumb. Use two or three of your fingers to feel for the burst. You can also feel for their pulse on their neck. From the midline, run your fingers towards the uh, side. About 2 centimeters or 1 inch from the midline, you should feel that burst. That is a carotid artery. If the carotid pulse is there, then that person is unconscious, but that person is not having a cardiac arrest. If they had a cardiac arrest, it is a different ball game. They won't be responsive, they won't have a pulse, and they will not be breathing. But if they have a pulse and they are breathing, even if they are not responsive, that means they are not having a cardiac arrest, and so you can buy time. So what might cause a person to have the pulse and breathing intact and yet they are unresponsive? Well, some might have been in a very hot environment, a very crowded bus or place, and then they react to the extreme heat. Maybe they are sweating profusely. They may also be hot if you feel their body. So they collapse as a result of heat syncope. If that happens, all you need to do is remove any tight fitting clothes from them. If they are wearing tie, remove it, remove their jacket, loosen their button. If they have a tight chain around their neck, remove it so that they can be free. Move them to an open, airy place and then begin to fan them. You can also use cold compress on them. You can dip a face towel in water and then press their body with it while fanning them. If it is heat syncope, in a short while, they will open their eyes and thereafter, you can give them something cold to drink, but never give an unconscious patient something to drink because they might aspirate and that might kill them. But what if the person has been standing for a while or they just rise up from sitting position and they feel lightheaded and then they fall? It could be that they have hypotension. And when you check their blood pressure at such a time, it might be reading as low as 60/30. Yeah. So that is hypotension. And all you need to do for that kind of person, remember, they have a pulse and they are breathing. All you need to do is let them lie flat and raise their legs higher than their heart. So raise their legs over something about 30 centimeters above the body so that blood flow to the brain can be restored. And then that person, their blood pressure will come up and then they'll be fine. In a short while, within seconds or within a minute, that person may gesticulate with their hand or open their eyes and speak. Yes. So when such a person has regained consciousness, you can give them something to drink. ORS will boost their blood pressure. You can put salt in water for them if you are sure that that is what they are having. Yes. But for some people, you might perceive like alcohol from them, or they might have been taking illegal drugs. Some have been taking codeine, some have been taking colos, anything that they might have been taking. It could be that it has become toxic to their system. In that case, make sure that you turn them on their side and make sure the upper leg is folded at the hip and the knee at angle 90 degrees. That is called the recovery position. It is the best position for them because they will be able to breathe, and if they vomit, it will go out. They will not aspirate the vomitors. Some, it is because of overdose, but some, it is because they are having an unexpected reaction to a small dose of whatever substance they have taken. So if that is the case, move them to the hospital in recovery position. Now, what if that person is now convulsing? Yes, some of these people that use substances might convulse, or a person might convulse because they have seizure disorder. People call it epilepsy. Please stop calling it epilepsy. We call it seizure disorder. It is more dignifying. So if a person is having a seizure, it is either they are stiff, their body is very stiff, or they are jacking. Whichever it is, they are best helped by rolling them to their side and staying with them. Make sure that you have loosened any tight clothes around them, and then be sure the environment is safe for them, so that there is no fire that they can fall into, or water that they can drown in, or chemicals that can pour on them, and they're on a flat surface where they cannot fall and get injured. So once the environment is safe, even if they are bleeding from their mouth, because some of them will bite their tongue and then you see blood, it will be scary, but don't bother, they will be fine. And these seizures don't usually last. They may not last more than 3 to 5 minutes, and after that, that person will calm down. All the jacking and the stiffness will be gone, and they might open their eyes. For some of them, they already know what happened, and for some of them, they just sleep. From the seizure, they sleep. Once you see that a person who was jacking has stopped jacking, you can tap them. If they are sleeping, they will wake up, they will open their eyes. They might sleep again, but at least they will respond by opening their eyes. Then you can be sure that they are fine, and thereafter you can give them any further assistance that they need. If the person that collapses has weakness of one side of the face, and then they cannot move one side of their body, or they cannot talk, or they attempt to talk and their speech is slurred, then that person is probably having a stroke. In that case, put them in recovery position also, and then take them to the hospital. Do not give them malt or milk. Do not give them anything to drink, because whatever has affected their speech that is making them not to be able to talk may also affect their swallowing. So if you give them something to drink, they may aspirate, they may die. So don't give them anything to drink. But in case of a heart attack, that person is having a serious chest pain and they are holding, on tightly to that side of the chest. In that case, it is a heart attack. Take them to the hospital as soon as possible, because what they are having is impaired blood flow to a part of the heart. And what they need is restoration of blood flow to that part, and it can best be achieved in the hospital. So be heading for the hospital while you support them in a sitting position. But if they don't find sitting position comfortable, let them take any position that is comfortable for them, but keep an eye on them, because a person who is conscious and is having serious chest pain may lose consciousness at some point. If they lose consciousness, then the approach changes. Your approach to them should change. But if they have not lost consciousness, just make sure that you support them in any position that they find comfortable, and then take them to the hospital as soon as possible. Now, what if the person is a known diabetic? A known diabetic, maybe they have taken their medications. Sometimes they might not have eaten well, or the medication is giving them side effects. And one of the side effects can be hypoglycemia. The sugar becomes too low. In that case, that person needs to be given sugar, or a sweet drink or food. How will you know that they are having hypoglycemia? Well, the best way to know is to do a sugar test, but you are outside of the hospital and there is nothing to use to check. So what you can use to know is, what are the symptoms they are having? Their body might be shaking, they might be confused, talking irrationally, and they are sweating. In that case, if they are still conscious, then give them something to drink. That will restore their sugar quickly, and then you just see a transformation from being confused and weak to being, very oriented and fully conscious. So that is what to do if that person, you suspect that that person has hypoglycemia. But what if this person that has collapsed does not have a pulse and they are not breathing? that means that they are having a cardiac arrest. And for cardiac arrest, the approach is completely different. The approach to cardiac arrest is to begin CPR immediately and target using an AED. That is what we will consider in part two of this discussion. But before part two, let me quickly tell us what we should not do to people who are unconscious. If a person collapses and they're unconscious, please do not slap them, do not shake them violently, do not put very hot balm or pepper on their eyes, in their nose, so that they can sneeze. Now, do not give them anything to drink or to eat. Do not pour water on them. It doesn't help in any way. Just put them, as long as they have a pulse and they are breathing, put them in recovery position or do all of those things that we have earlier mentioned. For watching, I hope this helps. I'm Dr. Abosede once again. Please share this with everyone that you know, every family member and every friend, because together we can save lives if we know what to do if a person slumps beside us. And again, remember, good health is great wealth. So I'll see you next week, God willing, with part two of this discussion. Until then, please be safe. Bye.